applied today as enhancement, because by calling them enhancement, we are already implicitly accept them as good. I think we should call them, for the time being, modifications, because there are many examples from all fields that interventions with the best of intentions have catastrophic results, sometimes. Concerning Professor Lachman's presentation, which I found very interesting, the take-home message I take for the presentation is that we are still using an ethical system developed for an endangered species, while now we are not an endangered species, but an endangering species, and we have not developed the appropriate ethical system. Thank you.
In order to keep this organized, John Harris will answer first. I think Inez and Maria also want to chime in. Then it's Peter Lachman, and then I'll take a question from Professor Christie, and a question from up there, from my Manchester colleague. And I think then we'll close the proceedings of the first session, because we have lunch waiting for us. John.
I think in response to that very interesting question, the distinction that we need to concentrate on is the distinction between medical means on the one hand and the effects produced by medical means, which may be therapeutic or non-therapeutic, they may be enhancing, they may be modificatory, they may be disastrous. And of course, by medical means, we just largely mean things that doctors are uniquely licensed to do. In other words, things that doctors have, through operating a very powerful trade union, acquired the right exclusively to deliver. It's a sort of monopoly that doctors have. What interests me is, so to speak, whether the effects are worth having. And it matters not to me, and I think it shouldn't matter to anybody, whether they are delivered by medical or non-medical means, except insofar as there are more or less reliable quality controls. Now, the last part of what you said, recommending the use of modifications rather than enhancements because of the evaluative load that the term enhancement bears, that also goes for therapy. Lots of therapies have proved to be absolutely disastrous. So there is no necessary connection between medical means and good results. It's a contingent connection, and of course, sometimes it's contingent upon luck, and sometimes it's contingent upon very good trials and a whole range of other things. So I think the distinction we need to concentrate on, actually, is the distinction between medical means, which just means that doctors have acquired an exclusive right to practice, and the various sorts of effects of interventions, which may be therapeutic, which may be enhancing, which may be neutrally modificatory, but not enhancing or indeed disastrous, and so on. And if we chart our way through that terrain in that way, then we won't beg the question in favor of any particular intervention, but like all interventions, I hope we will examine them for their benefits versus burdens. I mean, that's what we have to do with everything, and that goes for other sorts of innovation like cell phones or motor transport or anything else. And of course, the balance of whether they are overall a net benefit or a net burden on humanity shifts over time and may shift with the amount of that particular thing that is done or that particular product that is available.
Very shortly, I think your question brings about this issue of freedom also, and of the option to refuse so-called enhancement. That is one of the things that worries me, that it becomes sort of natural to have the enhancement because you're expected to be taller and you're expected to be more beautiful and you're expected. There is a huge pressure on individuals, which I think is sometimes be justified when it comes to moral enhancement. But with all kinds of other enhancements, I have great doubts.
You're expected to be literate and educated. And indeed, societies go so far as to ensure that that happens as far as is possible to the majority of citizens.
I'm also expected to be slim, I'm expected to be tall, I'm expected to be beautiful, I'm expected to be elegant, I am, you know, there are a lot of expectations that I will not try to live up to. Literate and elegant, yes.
Thank you very much.
On top of having to have the children, yes, it's grossly unfair.
Maria and then Peter Lachman.
One note I would like to make is that what we call in applied medicine the patient's consent, which one can transfer to everything. A patient's consent is when somebody needs to be operated or go through any treatment, a medical doctor is obliged in any organized place of the world to explain to him the pros and the cons in detail to him, and then the person has to sign. So there are different ways to do it. Some people just offer the patient a paper to sign. By that I mean people need to be informed. I think few people know why we have an elevation of breast cancer the last 30 years. What bill we pay with that? You know, we pay a bill, a socio-economical bill with that. So my end conclusion is we need to really inform the people. And coming back to you, I believe certain things are our obligation. We are the ones that have the information. We are the ones that have the responsibility to give information to the people we are confronted with them. We give them the offer, but we need to give them the complete information.
Provided that individuals can make rational decisions.
They can make them
which
afterwards.
Is the whole mythology of free choice.
Yeah.
In any case, Peter Lachman.
Yes, I think we are propounding some degree of myth here about the free availability of enhancement. The one field where this is actually entirely possible, which is in sport, it is rigorously restricted and largely forbidden. In other words, the use of drugs to enhance athletic performance, which are indeed available, and quite easily to do so, though they're not safe, is forbidden by all international sporting agencies. We spend huge amounts of money testing athletes all the time to make sure that they've not taken any of these enhancing drugs. So the idea that the prevailing view is to allow enhancement whenever anybody wants to do it is simply not true. There is, in fact, a great deal of restriction based on the concept of fairness, that athletes should compete on the basis of what they're endowed with by nature rather than what they're endowed with by pharmacy. And it's actually not quite logical, because where it's illegal to elect yourself with EPO, it's entirely legal to go and train at 10,000 feet for 6 months so that you put up your hemoglobin itself. So I'm just saying that's very much more complicated. As far as the medical use of enhancement is concerned, and after all we are in Greece, this is primarily determined by Hippocrates' dictum primum non nocere, though I would point out to you that Hippocrates would not have said it in Latin. But the idea that doctors do not do their patients any harm, and of course many of these procedures, their long-term safety has never been evaluated, and a very good reason for being very cautious about using them is until proper controlled trials have been done of long-term safety, one won't be very careful. The injection of growth hormone into people is not entirely harmless, for this reason, although there is evidence that in aging people it may do you some good, there's also evidence that it may give you cancer. So one has to be a bit careful about all these things. And I'm not actually sure this is largely a moral question as such. It's actually a safety question, and that is the primary medical ethics to do no harm. Mr. Chairman, may I say a word about personhood in response to what was said?
30 seconds.
50.
45.
The Aristotelian view, which was adopted by the early and medieval Christian church, was quite clear. Fetus vegetalis became fetus animalis, which is when it acquired human dignity, or if you like to use the word personhood, occurred when their gender was first perceived, which gave the odd result that males achieved personhood at 40 days of conception and girls not till 80 days, which seems a little illogical. But it certainly didn't happen at conception. The idea that human dignity is acquired all in one go at conception was an attempt to catch up with 19th century embryology when people actually realized that conception took place. But it unfortunately, Pius IX and nobody at that time realized that the majority of the conceptuses so formed are never even implanted in the uterus. They are just shed, they are not buried, they are not grieved, and the woman doesn't even know about them. And therefore, in the classical religious view, the great majority of the inhabitants of heaven, either now or after the second coming, depending what view you take on this, are these unimplanted conceptuses who can't have sinned because they don't have anything to sin with, who would be the majority of population because they're the majority of what happens to conceptuses.
Making heaven a very stimulating place.
But let me just say, the whole thing about potential, that these things have the potential to humanhood, has been thrown into complete confusion by the recent findings, particularly of Yamamaka in Japan, that you can de-differentiate any cell and turn it into a potential fetus. So the potentiality of acquiring human dignity now relies with any somatic cell. This leads to the picturesque conclusion, as one of my journalist colleagues said, that one ought to bury one's dandruff. I cannot imagine that is what Pius IX wanted, and I cannot understand why the Church, who really doesn't generally support things that are totally absurd, hasn't gone back onto this, this observation, which clearly has no meaning. One does not, potentiality does not give one full human dignity, and full human dignity is not acquired until one has the potentiality for some contact with the outside world. Thank you.
We'll take all three questions together. Professor Christie, Professor Polemachakis, and John Cogan. Professor Christie first. That will be good, George.
Just a quick comment on the interchange between Professor Harris and Professor Lambridiadis. Although I guess I could be considered a co-religionist to Professor Lambridiadis, my views are more akin to those of John Harris's, but I think John is really a little unfair to Professor Lambridiadis. I think he would start for the proposition that what he was saying is the beliefs of the Orthodox Church are self-evident, or at least if you thought about them, you would find them self-evident. You might not. But the reason for even making that point is your suggestion, which I'm sure comes from John Rawls, but Amy Gutman and others have made it, that you cannot have public debate unless the debate is premised on propositions that everyone or almost everyone accepts. And that's intolerable in a democratic society because it would require that the debate would be restricted to a very small group of people, to an elite who share a certain common view of things. And I'm sure that isn't what you wanted to say, but that's the implication of that view. That's all I wanted to say.
I'm a bit puzzled by Professor Lachman's statement that athletes are expected to compete with what nature has endowed them. Clearly, we don't prevent training. We allow them to take aspirin if they have a headache. So I wonder where we draw the line between illegal and allowed enhancement.
Thank you. I was thinking about John Sulston's talk yesterday, which I thought was very powerful, and it presented really huge questions that face us and that we need to respond to, or else we're in quite a bit of trouble. And John talked in his talk, as I understood it, about pragmatism and compromise. And I wonder if these fundamental moral, I mean, at least two people on the stage I know will never agree with each other on some fundamental moral questions. And I wonder how much that matters, and whether we ought to be directing these debates to more pragmatic concerns instead of worrying about, you know, the sanctity of the embryo and things like that.
We'll start from John Harris, pass the floor to Peter Lachman. Any other